Hey there, if you're suffering with thumb pain and you didn't fall, you didn't break it, didn't have surgery, right? But you're going to traditional hand therapy and it's not helping you. My name is Huang. I'm an occupational therapist and certified hand therapist. And I want to share with you why traditional hand therapy might not be helping you with your thumb pain. And this is very specific for if you don't have, if you didn't injure it, like you didn't fall, you didn't break it, you didn't tear anything, there wasn't some incident, accident, or anything like that, right? So it just kind of came on slowly. This is for you if you've tried wearing the splint and you know you wore the right splint. This is for you if you're sitting there doing, squeezing a ball, squeezing some putty, and somehow or another, traditional hand therapy isn't helping you. I want to share with you what you may look into or ask your therapist about. I've been treating for over 20 years, and as a certified hand therapist, I've worked with my fair share of people with ligament tears and surgeries. They have known fractures of their hand, even people who have been told that they have arthritis. And I don't want to put it in quotes, they have arthritis, but that doesn't necessarily explain all of why they continue to have hand pain. And no matter what happens, they can't seem to get it. So here's something to consider, and I know it sounds kind of crazy, right? But hear me out. If you have thumb pain, understand that we have some nerves that come and give our thumb power and give our thumb sensation. Now, there's a typical nerve that comes and you have sensation here at the tip. This is actually called your median nerve, and a lot of people know about carpal tunnel. We're not talking about that. That kind of pain hurts in a different way in a very specific time, right? But some people are coming to me and they're having pain back here and they can't seem to explain it. Sometimes they feel a clicking or a cracking, but the most important symptom that they have is like there's just this deep ache inside their thumb. Well, this might be a different nerve called a radial nerve. Now, it's really extremely important if you're going to traditional therapy and nobody is looking at your whole hand. One of the things that I like to do is I look at the whole hand and I evaluate it and say, okay, what could be wrong? And if I cannot find it there, I'm gonna look beyond and I'm gonna go and look at the elbow, because that nerve that goes to the thumb that could be contributing to your thumb pain could be something going on up here at the elbow. And then after I look at the thumb, at the elbow and the hand is connected to the shoulder, right? And so one of the things that I'll look for is I'll look at what's going on in the shoulder. We're looking at all the motion. Now, you might be thinking, well, I don't have any pain in my shoulder. I understand. You might not have any pain in your shoulder, but sometimes there's a lack of motion that you haven't been paying attention to. And you want your therapist to pay attention to that. So one of the things that I look at is I don't look at the quantity of your movement, because a lot of people are like, but Huang, I can raise my arm. I actually was working with a really young, fit guy. He was in his 40s. And I say young because I'm in my 40s and I think I'm still relatively young and I shouldn't have the kind of pain that people sometimes come to me about. He's in his late 40s. He's an active guy. He swims. He likes to work out. He also likes to write a lot. And he was starting to notice that after about 20 or 30 minutes, his hand would just get really tired. And it didn't make any sense. And when I said, hey, do you mind if I look? I'm going to look at your thumb, but I also, if you don't mind me looking, I'd like to look at your elbow and your shoulder, and I'd like to look at your neck. I know you might not have pain there. And he's like, well, I kind of don't, but sometimes I feel really tight. Pain isn't the only indicator that something is wrong. So if you're trying traditional hand therapy and it is not helping your thumb, I really encourage you to not give up on therapy. Because I think a lot of times I work with people who just like they give up on therapy and then they live with the pain for years. And I'm using this video and this platform here on YouTube where I think most people are looking for like, just Huang, just tell me what exercises to do, right? Just tell me which muscles to strengthen. Just tell me which way to move. But if you're moving at the wrong place in the wrong direction, it's not going to necessarily help you. So I would really encourage you to find a therapist who's willing to look at your whole arm, right? Because the thumb is connected to the elbow, it's connected to the shoulder. And crazy enough, the nerves that come down our arms all starts at the neck level. And so sometimes when people are really stiff up here and you feel tight here all the time, you're going to compensate and use your body in a way that maybe it wasn't meant to be used that way forever. And our bodies are extremely, extremely smart, and it will just adjust. But what happens is over time, it adjusts. The thing that helped you no longer is helping you, right? So, one of the things I look at is not just the quantity of movement, but I look at the quality of the movement. And though your arm might raise all the way up, one of the things I look at is rotation. So, this is called external rotation. And sometimes people limit internal rotation, right? They're not as evenly, they can't, one arm can't move as well as the other. And we're looking for those little differences. And this is why I always tell my patients, like, it's okay to come to therapy, because what someone is looking for is different from what you're looking for as a person suffering, right? If you're the client, if you're the patient, it's helpful to have someone outside of yourself look and say, oh, because they can see better. You have extra eyeballs on you to say, oh, she's seeing or he's seeing that, oh, my arm isn't moving as well, or my arm doesn't have that much motion in that area. It doesn't necessarily mean pain. It just means like you have a little bit of limitation. And sometimes the limitations at the neck, at the shoulder, and at the elbow can cause thumb pain that just does not go away. And if someone is rubbing on your thumb, if someone's massaging your thumb, and you're exercising the shit out of it, you're wearing splints for over a month, 2 months, 3 months, and you're like, I still can't seem to get rid of it, then traditional hand therapy is not going to help you with your thumb pain. And and surgery and injections are not always the case, right? Now, you can do those things. If that's what you want, by all means, go and do them. I just want to encourage you that if those things don't work, you can also come back to therapy and make sure someone is doing their due diligence of looking at your whole arm, right? That's what has been working for me, with my staff, with my patients. We look at the whole arm. We look at the thumb and ensure, okay, well, if there's nothing on the thumb, then we've got to continue to look up at the elbow and say, okay, what muscles? Because the muscles that come to the thumb all start in your forearm, and the nerve that goes to your thumb starts out of your neck, come down your shoulder, and it passes right here past your elbow and comes down to your hand, right? So that's where all I want to encourage you. It's not so much that there's something that you can do, because it just depends on where your problem is, but a true evaluation will help you. A thorough evaluation will help you if you have found that traditional hand therapy has not been helping you with your thumb. I know that I reach a lot of therapists who watch this. If you're a therapist watching, please go through this with your patients. And then if you're the patient, if you're suffering from thumb pain, just know that help is possible, and it just requires someone to just look at every aspect of what makes a thumb work and what makes a thumb work really well, so that you can do anything that you want, and your thumb will last you forever. Your thumb does 50% of the work of your hand, and it is meant to last you a lifetime. The key thing is, so we got to take care of these things before they become really bad and before they become really painful. So no matter when you find this video, I just want to encourage you that the help is possible. And if you haven't found it yet, to please keep looking. You're going to find somebody who's going to be able to help you. If you're someone who needs my help, I am located at Hands-On Therapy Services in Miami, Florida. But if you're not in Miami, Florida, and you want to find someone, look for an occupational therapist or a certified hand therapist to help you. And be proactive with your care. If you like videos like this, click the subscribe button and grab the links below for any resources you might need. Until next time, thank you so much for watching. I have other videos all related to thumb and what you can do for your thumb if you have any pain or limitations. Okay, go check those out.